Hi guys, welcome to my YouTube channel. My name is Dr. Canfield and I'm the owner of Simple Truth Chiropractic in Grand Rapids, Michigan. Today what we're going to talk about is sciatica and the different causes of sciatica. Now sciatica is typically described as pain on one side of the leg or buttock. It's very rarely in both legs. It's usually worse when sitting, and it's often described as burning, tingling, or a searing as opposed to like a dull ache. There's usually weakness, numbness, or difficulty moving part of the leg or foot, and it's usually a sharp pain that may or may not make it pretty difficult to walk. There's multiple causes of sciatica, and some of them are true sciatica and some of them are not true sciatica or true radiculopathy, which I'm going to get into. The most common cause that I see in my office is actually a herniated or bulging disc, and it may differ by each person based on which disc level is herniated, and I'll get into that at the end. But what that does is that disc herniates out and it pinches the nerve that's exiting, and then it causes weakness or the radiculopathy down the leg. The second cause is typically disc disease or degenerative disc disease or DDD or degenerative joint disease. You hear it a lot of different ways. But what this is it's actually a condition of basically getting older and aging where the vertebrae haven't been in proper alignment for an extended period of time, and that disc basically just gets crushed and squished down, and then it prolapses outward and causes the nerve to get pinched, causing the same sort of sciatica radiculopathy symptoms. The third type that I see in my office that is kind of a mystery to a lot of people and gets misdiagnosed quite frequently is something called a spondylolisthesis. This is actually where the interconnecting bone of the vertebra gets fractured. It's called a stress fracture. You actually don't feel anything from this fracture. And one vertebra slides forward on another vertebra, and that's called a spondylolisthesis. And what that does is as that slides forward, it causes irritation to the disc and the nerves around that, and then it can cause that one-sided low back pain. And it's very common in young athletes to have a spondylolisthesis. And the fourth common cause is something called stenosis. And stenosis is just Latin for narrowing. And when you talk about spinal stenosis, it's where the spinal cord just gets narrowed like this. And stenosis can come from a variety of reasons. Usually it's in males or females, but most commonly in males, over 60 years of age. And it's usually a degenerative condition where that spinal cord narrows, but it can also happen in rare cases from a tumor or a cyst that compresses that nerve root. Another common cause is something called piriformis syndrome. I see this very commonly with a lot of my pregnant patients. Piriformis syndrome is there's a muscle that attaches into your hip joint and it runs from your sacrum or your tailbone, and it's called your piriformis. And what that does is in most people, I'd say 50 to 60% based on studies, the muscle it's a nice thick muscle down in the butt, but the sciatic nerve actually will run right in between the muscle. And when that muscle gets really tight, it'll clench and squeeze down on that sciatic nerve. And usually if it's piriformis syndrome, what you'll notice is that the pain or the numbness will actually stop at the knee and will not progress down into the foot like with most other sciatica type issues with like the disc herniation, the degenerative disc disease. So if it is piriformis syndrome, that's usually a pretty quick fix. You can do some piriformis stretches, get regularly adjusted by your chiropractor, and those usually help with that. Another common cause of sciatica is something called SI joint dysfunction. The SI joint is the sacroiliac joint, and that's where your sacrum and the ilium, which is also known as your hip bone, those two meet and intersect, and when one of those gets twisted or out of alignment, or one leg's a little bit shorter or longer, it causes irritation and inflammation in that joint, and then it irritates the L5 nerve root, and then that can cause that same type of sciatica pain. Now, some other common causes are scar tissue from surgeries that can bind up and adhese the muscles and irritate the nerve that's shooting down the leg. A muscle strain, and in very rare cases, you can get infection of the bone or spinal tumors from cancer, and so those are much more rare. But you can usually detect those with an MRI or some sort of imaging. Typically, you need to do a contrast MRI if that's what you're suspecting. But that's where your chiropractor or your doctor should be able to eliminate that pretty quickly. Depending on which part of the nerve is affected, it's going to affect different things in sciatica. So commonly, if you've got an L4 involvement with sciatic, what you'll notice is that you'll get actually pain and numbness in the thigh, and then it may be difficult to straighten your leg, and then you'll have difficulty with your knee-jerk reflex. If it's an L5 nerve root sciatica, then what you're going to notice is you're going to notice weakness in the big toe and the ankle, which makes it very difficult to hold your foot up. That's known as foot drop. And what you're also going to notice is you're going to notice numbness on the top of your foot and into your big toe. And then most commonly I see numbness right into the webbing of the foot between the first toe and the big toe. The last nerve that can get affected is your S1, and the S1 nerve root is actually going to affect the outer part of your foot, so the pinky toe, the ring finger toe, or the ring toe. And what you're going to notice is that you're going to have difficulty standing on tippy toes. And that's a common test that we do in our office, and we try and figure out exactly the root cause of which level it is. And if we need to, we send out for MRIs, etc., just to determine exactly the extent of the injury. Now, if you are having any of these issues, I would recommend either getting into a structural corrective chiropractor immediately so that they can determine the exact cause of your problem, or the exact cause of sciatica, whether it's a muscle strain, whether it's a disc herniation, or whether it's just a degenerative joint disease. And these can be determined through x-ray. These can be determined through MRI. You can also do something called an EMG or an NCV study, which basically studies the conductivity of the nerves to see if there's any nerve damage. If you're having any problems or issues, feel free to comment on this video or give us a call in the office or email me, and I'm always available. Thank you for taking time to listen about more about sciatica, and hopefully you take a look at some of my other YouTube videos. Thank you.